Hello, my name is Jared Pinkham, and this is,
Carly Schuldberg.
thank you. And we're going to be presenting two case studies today, but our first one is a head injury patient who is experiencing hearing and memory loss. And this comes from ASHA SIG 6, which is Hearing and Hearing Disorders Research and Diagnostics. So some patient information, we're going to be talking about Mr. Roy today, who's a 55-year-old man. About 2 months ago, he fell out of a tree while boar hunting. And during this, he sustained a closed head injury and lost consciousness for about 20 minutes. He went to the hospital, completed an inpatient rehabilitation program, and was discharged home. But some of his symptoms that he has stated has gotten worse since being seen at the hospital include memory loss, word finding problems, high frequency tinnitus, difficulty understanding speech and noise, hearing loss, episodic vertigo, and headaches. And again, he's all said that all these symptoms have gotten worse since being seen at the hospital 2 months prior.
So the team involved in Mr. Roy's treatment include the audiologists, of course, as well as a neurologist, a primary care physician, an occupational therapist, and a physical therapist to address not only the head injury itself, but all of the impacts and the residual effects that he's been having as those symptoms have worsened.
So the team members' plans. So the PCP really just served as the team facilitator. So any meetings that had to happen were facilitated through them. Any communication, especially through the patient, would typically happen through the PCP. The SLP wanted to conduct a standardized speech language assessment and cognitive evaluation. The OT wanted to discuss hunting safety strategies to prevent any future falls from happening. The PT wanted to conduct posturography and balance evaluations to see why some of that dizziness is happening. The audiologist role was to perform comprehensive hearing evaluation, tinnitus evaluation, and vestibular assessment using video nystagmography or VNG. The neurologist conducted a CT scan, MRI, and EEG, and then also some cognitive and neurologic assessments. So looking at the results, there are definitely some information that I wish we had kind of some case history information on, especially in the audiology realm. No talk about any like previous noise exposure or any previous hearing loss. I definitely think someone who's a hunter, I don't know if this is an occupational or more of a hobby activity, but didn't talk about any previous hearing loss. So I'm curious to see if that was a thing. But the results that they got from the audiology was mild to severe sensorineural hearing loss bilaterally with poor thresholds in the left ear from 3,000 to 6,000 hertz. And these were consistent with SRT. They didn't actually specifically state what the SRT was, but they just said it was in agreement. There was no word recognition scores posted within this case study, so I'm not sure about that. But they did do speech and noise tests, especially considering he had been complaining about not understanding speech and noise. And they used the Quicksin, which revealed a moderate difficulty in the presence of background noise. The VNG did reveal a right-sided benign proximal positional vertigo, or BPPV. And then tinnitus was confirmed through tinnitus matching, and he was confirmed for bilateral tinnitus and was pitch matched at 6,000 hertz. The SLP found that Mr. Roy had mild word finding deficits, memory deficits that were consistent with a mild traumatic brain injury or an MTBI, which is consistent with his case history, but did have normal receptive language skills, oral motor skills, and no speech deficits, which is great, what we want to see. The PT found that he had normal functional balance, which is great, but did test positive for right posterior canalithiasis, which is consistent with what the audiologist found. And then recommended to for OT for any tree safety training that would benefit Mr. Roy. And then the neurologist found that through the CT scan was normal, the MRI was consistent with aging, but his EEG was abnormal. And I'm going to talk a little bit about the results on the next slide. And just kind of a preface to this, the case study didn't actually really state what any of, kind of these neurological imaging results actually meant. It literally said, MRI was consistent with aging, CT was normal, EEG abnormal. That was all the information. So I did a little bit more research to kind of better understand. So over here, we have his MRI results, which show pretty normal. I'm assuming. I do not know necessarily how to read an MRI. But so some background on like what an MRI, CT, and EEG do. Both the MRI and CT scans show structure and tissue at one point in time. So this is great for looking at tumors, bleeding, any swelling going on in the brain, while the EEG shows real-time brain activity and function. So for our patient, Mr. Roy, normal MRI and CT scan suggests that there are no structural damages that are causing his memory or hearing issues. So there's no tumors or bleeding or swelling that's really causing this. And then the abnormal ENG suggests that there's an abnormal transfer of information in the brain. Again, they didn't really give any specifics as to what was abnormal about the EEG, but I'm suspecting most likely disturbances in the hippocampus in the Broca's area, considering some of his symptoms.
So going forward, each individual in the team made a plan. This isn't something that can be just kind of resolved in one go. So the plan from the evaluation on for the audiologist was to conduct a hearing aid evaluation, fitting, verification, validation. Mr. Roy has hearing loss, whether that is exclusively due to the head trauma or due to aging as well, or other situations. Like Jared mentioned, we don't have a lot of case history on other things that could have played a role. But regardless, we want to treat that hearing loss, provide amplification, and provide auditory access to limit any lasting effects of that, any auditory deprivation or cognitive impacts, as well as programming those hearing aids with a program specific for hunting. We know that despite his age and despite an incident, Mr. Roy is likely to go out and continue boar hunting. And so having that program, they've planned to assist him in preventing any noise exposure, any further damage to his hearing, and also to enroll him in an integrated sound therapy as part of the tinnitus management program, which will hopefully benefit him in adjusting to that tinnitus and no longer experiencing those negative effects. The SLP planned to have weekly 45-minute sessions for 3 months to focus on word finding and memory strategies to assist with the abnormal functioning of those areas that Jared mentioned, and hopefully to combat any effects of that auditory deprivation that Mr. Roy may have had just due to him not having his hearing loss treated. The PT planned to perform repositioning therapy for that BPPV, and the OT, as was mentioned before, wanted to work on tree safety with Mr. Roy because he's going to continue to do this. We want to make sure that this incident doesn't happen again and cause further damage. The neurologist, with the results that they got, just want to follow up as needed and kind of keep an eye on Mr. Roy, make sure there are no lasting impacts later on.
So the treatment outcomes. So from the audiologist, they report that Mr. Roy's tinnitus has greatly improved since being enrolled in that integrated sound therapy. He also reports great benefit from his hearing aids while hunting and even playing poker. I think that's something that's always great about audiology is that, we have these patients that come in with specific issues or struggles, and we provide them with amplification or other assistive devices, and they don't even realize that they're having deficits in other areas of their life until, they get these devices. The SLP reported that Mr. Roy shows improved word finding ability. He shows no change in any of his memory scores, but he does report himself improved quality of life from using his memory aids, which is great. This is something that I would definitely want to refer back to neurology about, just because, that abnormal EEG and still having memory issues is definitely a concern. The PT reported that his dizziness has resolved after that repositioning, which is great. And then OT reported that Mr. Roy's custom-made harness allows him to climb up and down trees safely. I think that's great for him because, he can continue to go through this. I think a lot of the times patients who kind of go through this IPP plan, they're often told that they aren't able to do things, especially after having such a serious accident. But I'm glad that this team could kind of find a way to keep Mr. Roy's recreational activities still part of his life. So some ongoing plan and follow-ups. So the IPP team followed up with Mr. Roy 3 months post his initial evaluation and determined that the plan was providing adequate benefit. So his hearing aids were working well, speech therapy was going well, no falls reported, which was great. The PCP follows up as needed and communicates any assessment results and new plans with the team. This team specifically meets together weekly. They have several other patients that they work with. So I think that's really great that they have that Mr. Roy has such a dedicated team to provide him care, and that they're continuously, going back to his case and making sure that everything's okay with him. And then these are references. So you can see here, this is where we got the actual case study. And then these bottom two are just kind of information about CT, MRI, and EEG testing.